All right, let's have some fun. Welcome to the Med Story Podcast, where healthcare meets storytelling. I'm your host, Spencer Lalk, and today's guest is someone who truly bridges the gap between science and everyday life. Dr. Nate Wood is a board-certified physician, trained chef, and the director of culinary medicine at the Yale School of Medicine. He's been featured in outlets such as the New York Times and Good Morning America, and has the ability to take complex medical concepts and make them clear, relatable, and actionable. In this episode, Dr. Wood shares his journey from clinical practice to national media and explains how physicians can improve their communication, whether speaking to patients, pitching producers, or simplifying science without losing accuracy. Now, if you're new here and you want to learn more about branding, entrepreneurship, and really just building a business, then this episode's for you. So go ahead and subscribe, and we'll dive into the episode. So tell me here, what's one thing that doctors or other healthcare providers tend to overlook when they're communicating medically related information?
Yeah, that's a great question. I think doctors are used to speaking to other doctors, and so we use a lot of jargon. And patients know less jargon than you think they do. And so communicate things in a really easy to understand way. I think that's the thing that's most often overlooked. I was actually, as an example, I was recently talking to a friend of mine. She's very smart. She knows nothing about medicine at all. And I was explaining to her how I was learning about this process by which when we consume inorganic dietary phosphates, they combine with the calcium, the ionized calcium in our blood. They precipitate out as a salt. That salt gets embedded in our vascular intima, and then that actually causes these cells to lay down hydroxyapatite, which we as physicians know is basically that's what bones are made of. So I was explaining this to her and I was like, your blood cells lining the inside of your blood vessels, they start making bones in your blood vessels. And she's like, what? That's crazy. But if I hadn't described it that way, she'd be like, oh yeah, osteoclastic transdifferentiation with hydroxyapatite. And so I think sometimes we get so caught up in explaining things in a perfectly scientific and specific way that we overlook the fact that sometimes when we do that, we're not able to capture the real essence of the pathophysiology or what we're trying to communicate for the average patient. And so you have to really be trying to speak at an 8th grade reading level, which is hard to do, but it's worth our effort. And I think we often forget that.
I work with many physicians on their communication style, and I even say go to 3rd grade.
Love
because oftentimes it's hard for them to just say, make it as simple as possible, but then try to relate it to their life. So if they've talked about a certain goal that they want to have, try to link it with that goal, but then keeping it as simple as possible. And I find that actually hits home a little bit stronger.
Love it.
And so for you, someone that has now navigated both academic education, but also mass media, you've been on very big news outlets. They're two totally different environments. And how do you tailor your message based on the audience that you're speaking to?
You have to think about like how much does your audience know and how much do they need to know? You really just have to keep your audience in mind, honestly.
But were you always able to flip that switch based on it, or did it take a lot of practice?
Oh, it definitely takes a lot of practice. Yeah. You speak to your colleagues in a certain way, and if you were to try to really dumb it down for them, they'd be like, yeah, I know this. And you're like, okay, I can go to a higher level here. And when you're speaking to patients, sometimes you're speaking at that high level and you just see them, either eyes are glossing over and you can tell they're not getting what you're saying. Or you try to do a teach back with patients and you say, okay, can you explain to me what I just explained to you? I want to make sure you understand it. And then they try to explain it back. You're like, okay, I did a really bad job of explaining this. They have no idea what I'm talking about. There's been many times where I'll sit down with a patient and I'll say, I heard that you were just recently diagnosed with heart failure. Did anyone tell you what that means? And they have no idea what heart failure is. They just think they're like 1 foot in the grave and they're going to die at any moment. And I have to tell them, no, this is what heart failure means. We have great treatments. You could live for 20, 30 more years. And so it's empowering when patients understand what's going on with their body, right? And so that's, I think, really what our goal should be. But you really just have to think back, what did I know when I was in 3rd grade, when I was in 5th grade, when I was in 8th grade, when I was in medical school, and tailor what you're teaching people to that recollection. And it's hard to recollect, especially when you're a doctor and you've been in training for 30 years to say, oh goodness, what did I know in high school versus undergrad versus med school? But you really just have to tailor that to your audience.
What about for those doctors that would love to get on some media outlets like you have before? Any recommendations of strategic partnerships or networking that they could work on to start getting those slots?
Yeah, it's, I think, really important that we do this. And we realized that during the pandemic hit, most of us who understood the implications of COVID and wanted to help people live healthy lives in that time and avoid illness and death felt like it was important that we got out in the media and talked about things like that. But if you hadn't been already doing that, you realize it's a totally different ballgame to have to do that on TV and to speak with reporters and media people. They're looking for one thing, we're looking for another, and you have to find a way to come and meet them where they're at. So I'll say that if you want to get started, you have to know that you're going to have to work for free for a very long time. So you do not get paid in media. You just really don't. And you have to make everything for the producer or the journalist very easy. So if they say, are you free then? The answer is always yes. Clear your schedule. They do not want to go back and forth with someone to find a time, right? So you have to make time for them. You have to do it for free. If you're going to go in, so I started doing kind of cooking demonstrations. I send them an email and I say, I will be very flexible. I can do this anytime you want. I'll bring all the ingredients. I will prepare my talking points in advance and send them to you. I will tailor it to whatever number of minutes you want. I will bring demonstrations, and you really have to convince them that this will take no effort on your part, and I will come in and do something that is exciting and will teach your viewers something and will be fun to watch. If you're talking to a journalist, you have to think in advance, what are some good quotes that will convey the things that I want to teach, but will be catchy enough that they're going to want to quote me in this article, right? Because that's your ultimate goal, is to get your knowledge out there. But that is not their ultimate goal. Their ultimate goal is to get good quotes that people like to read, right? And so if you go on a 10-minute diatribe like I'm doing right now, that's not going to end up in the New York Times. But in the middle of this 10-minute diatribe, if you say one really pithy sentence, that is going to end up in the New York Times. So that's some of my advice there, but really it comes down to forming those connections. And so you start pitching to your local news. If you work at a university or an organization that has a PR department or a PR person, work with them, get out on social media and start there. And then you can use that as your reel to send to news stations and be like, look, I'm good in front of camera. I'm fun to watch. I say good things. I'm well spoken. And then they can see the proof in the pudding and they're like, okay, let's get this guy on here. He can hold his own in front of a lens. So I would say working on some of those things, it's called aspirational labor, because it means you're doing all this labor hoping it turns into something someday. And I still feel like I'm doing a lot of aspirational labor. Stay patient and keep with it. But I think those are my best tips.
This is super valuable, because I think that a misunderstanding that a lot of people have is that they're just going to automatically come to me and ask me for my opinion because you're a doctor. But that's not the case. Like, it takes work on the back end, that you're actively reaching out to them and you're developing those relationships. And have you found that it's gotten easier to do that now that you have that network to work from?
Definitely. It definitely snowballs. When I was first pitching to news stations, I remember pitching to something like 8 news stations, and 7 of them ignored me. And then the one said, okay, yeah, I think we could maybe do this, right? And then I came in and did it. And they were like, okay, that went well. Maybe we should do this again. And then you're doing it there again. And before you have a few clips, and then you can send that to another news station and be like, look, I do this already on another news station. Are you interested in having me? And they're like, oh, actually, yeah, that could work. And then it really snowballs. And then eventually you have enough stuff that you put it out there publicly, whether it's on social media or if you have your own website, and then people can search like culinary medicine media if they're looking for someone. They stumble on your site, they see all the stuff that you've done, and then it speaks for yourself, and you have to pitch yourself less and people come to you more. But it really starts with you. People will not just start coming to you. You have to get yourself out there first.
Have you ever practiced, like you were saying, the journalist cares about the quote that's going to be engaging? And I actually had a really good conversation. His name is Dr. Owen Meir. And he was saying that you have to learn how to say things in a way that's going to grab people's attention. And like you were saying, like, we need to start saying, how can I speak with these quotes that are going to be engaging, that's going to hook their attention? And have you ever practiced anything like that? Or has it just come through experience?
Both, I would say. It definitely will come through experience at different rates for different people, I would say. And the trouble is, you don't want to seem too rehearsed. Like, you do want to be genuine and natural and off the cuff. And so you can definitely over rehearse. And for journalism, that's less of a concern because they're just getting your words. But if you're going to over-rehearse for TV, it's really not going to be fun to watch. So I would think about the different mediums and perhaps how you want to do that and the level of preparation that you want to do. But I think you just really have to say to yourself, is this what someone wants to hear? Fruits, vegetables, whole grains, nuts, seeds, and legumes is a health-promoting diet. Or do they want to hear plants power your body to help you thrive. You know what I mean? They're saying the same thing, but they have such a different impact. And so like understanding the audience and the outlet and what the journalist is looking for will help you decide. I would not say plants power your body to thrive to the New York Times, but there are some outlets where I might say that and vice versa.
What is the benefit of you doing this? What are you thinking? What is your goal in the future? Why doing all this?
Yeah, so I've seen a lot of people on TV who are beautiful and charming and have no expertise, but just want to be famous. And they're really good at putting themselves out there and they have the resources to do so. And then they become famous and then all of their ideas become famous. So that's really frustrating to see. And 5-10 years ago, I really was deeply in medical media and looking at the types of people that had the loudest voices. And I was not happy with what I saw. And I said, the people who really need to be out there are the people who know their stuff. But those are not the people who are media trained or who have the time to do that kind of stuff or the motivation to do, because at least in academia, I can say it's not really rewarded. You're rewarded for research papers, not for TV spots. So it became a goal of mine to really help educate people through media. I learned to cook through media. I learned a lot about nutrition by reading nutrition articles as like a nerdy middle schooler. You know what I mean? So like you can learn a lot through media, and I think people already do. But now what they're learning is misinformation, right? And so we really are trying to combat that as much as possible. And it just so happens that I find media like thrilling. And so it's fun for me to do. So I do it because I like it, and I do it because I think it's important, and because there's a lot of people in my life where I grew up and in my patients and lots of other people I interact with who don't really have access to high quality information that's explained in an easy to understand way. And it's really my goal to bring that to them.
I love it. And I share that goal with you. Honestly, it's the reason that I started MedStory, is because I saw all of the crazy information and I saw how it was in real life impacting these people that are making terrible decisions for their health. And I'm like, why are our doctors not getting out there and doing it? And the truth is that they're busy like seeing patients and trying to do all these things. And so for you to step out and to make the extra effort because you're so passionate about it and so authentic is a big reason why you've been so successful. And it's only the beginning for you. And so I give you so much props for that.
Thanks.
If a physician, medical student is, maybe they haven't done any of this yet, where can they start to start working towards this direction?
Yeah, I think I will say you have to consume media and to do it with a critical eye. So I'm just really lucky in that I'm critical about everything. That's not lucky for my friends and family. But whenever I'm watching, for instance, a cooking show, I'm like, oh, I wouldn't have said that way. Or, oh, they took too long. Or you can tell they're getting rushed through this segment. And so watch everything you do with a critical eye. So when you watch the news, you can say to yourself, are they saying too many times? Are they not explaining this well? Are they repeating themselves? Are they talking for too long? Can you tell that the person interviewing them is not understanding or trying to move along and they're not picking up on the cues? So really watch media with a critical eye. And once you see enough people do enough interviews, you'll really get a good idea of what makes good television. And it's short, clear answers, smile a lot. You have to I'm not saying you have to be a model, but you can't be distracting. Wear things that are not distracting. Don't have distracting hair. Don't have a distracting beard. Hopefully this is not distracting. And like really be cognizant that people are looking at you and they're listening to you. And if there's a disconnect between those two things, then what your message is not going to get through. Look at media with a critical eye and try to learn from what other people are doing. Look at a variety of people and look at different levels, right? If you watch, I love the local news. I go on the local news. I have friends who work at the local news, but some local news stations, you'll see someone, you'll be like, I think I see why they're on the local news. And then you look at a national level and you're like, wow, this person, it's clear why they rose to the national level, right? And try to look at those differences. And I think really just by consuming with a critical eye, you can learn a lot about how to be good at media.
It's interesting when I hear you talk about that. I have noticed that I have started to do that when I say, oh, wow, I love how they explain something in this way, or, oh, no, that didn't sound good at all. And I agree that we need to spend the time that we're consuming media like this in a purposeful way so that we can learn, but don't let it get to the point where all you're doing is consuming.
Yes.
Because you need to get to the point where you start creating more than you consume, because you can consume all you want, learn all you want, but if you're not putting it into practice, it's useless.
Yep. Yep. And you can watch someone ride a bike a million times and fall, and then you can watch a mountain biker do an amazing race. And you can see, I think I understand, but until you're actually riding the bike, you're not going to get to a high level until you've done it many times, gone back and learned from your mistakes and looked upon it with reflection. And yeah, start consuming and get a good idea. But of course, at some point you have to get on the bike and really put it into practice. So I like that you highlight that too.
Do you ever have, talking about this, okay, getting out and creating, have you ever had any fear of insecurity about doing that?
Oh my gosh, yeah, of course. Yeah, definitely. No, I very rarely do I watch something back that I've done and think, that was perfect. I think maybe once ever. And I think honestly, never. There's always things that I do or say, and I'm like, oh, I wouldn't have said that way if I had the chance to do it again. And so I think you have to get over that a little bit. It's a part of this imposter syndrome, right? Where you feel like, God, I'm not the right person to do this. He should be interviewing someone else. Someone else could give better answers and they know more than me, et cetera, et cetera. But at some point you have to say, if not me, then who? And you have to try your best. And if you don't know something, you can be honest about that. You don't have to put up a front. You can be, I think, very genuine about what you do and don't know. Think long and hard about your expert matter and the tough questions therein, and learn how to describe the gray areas in an evidence-based but understandable way. And then I think that's the most that anyone can hope for. And whenever I'm feeling insecure, I remind myself of all of those people I mentioned before who are on TV and really should not be on TV, and think to myself, it's better that they hear my imperfect answers than whatever hogwash they're selling. So it is a lot of, no, I can do this. And I'm not sure that ever goes away, but if it does, I'll let you know. It hasn't yet.
Same here. It has not for me either. And you know what? No one has ever walked in your shoes, and no one will ever walk in your shoes. And you, as a healthcare provider, are experiencing life in a very unique lens where that story can actually really impact so many people around you. So don't be afraid, get out there, start sharing it, start making mistakes, and we're gonna keep helping the world in that way.
Great advice.
So if someone wants to check and see how you are educating the public, where can they go and learn about you?
Yeah, I put most of my media stuff on my website, Dr. Nate Wood, drnatewood.com. And there's a media tab where I do a lot of stuff with periodicals and then television as well. And I try to keep most things there. And so if you want to take a look and look at all my stuff with a critical eye, like I have too, that's where you can find me.
Amazing. Awesome, Dr. Nate. Thank you for your time.
My pleasure. Thanks.
Thanks for listening to the MedStory podcast. If you're a doctor who's trying to figure out ways to grow their influence, then reach out to us, medstorymedia.com. Or maybe you want to just share your story and tell us what you're learning. We'd love to have you on the podcast. So go ahead, visit our website, and apply to be a guest. We'll see you soon.